Today I'm going to be giving a report on a 13-year-old client who I completed a head-to-toe assessment on today. He was awake, alert, oriented ×3. His posture was nice and straight. He had a good steady gait. He was in good spirits. His BMI was equal to his height and weight. He was well nourished. His speech was coherent and clear and nice. His hygiene, he had no problems with his personal hygiene. He was nice and clean. And another thing was his mood. He was in a good mood. He was in good spirits. He was happy. Okay, so I moved on to skin assessment of the upper extremities. His skin was nice and warm and dry to touch, with good hair distribution. His color was appropriate for his race. He had good turgor. His hand, nail beds, and fingers were all nice and clean with the capillary refill with less than 2 seconds. His brachial and radial pulse were both intact. Okay, I moved on. I did his cranium. His head shape was accommodated to his body structure. I inspected his scalp. His scalp was nice and clean, without any infestations, redness, or dandruffs. He also had reported no thrills or tenderness in his temporal artery. So I went on ahead and started assessing his facial area. His cranial nerve 5 and 7 were both intact. Patient was very compliant in doing so. And then I moved on and assessed his neck area. I inspected his neck area. I didn't see any visible lumps or bumps. So I began to palpate his trachea. His trachea was nice and midline without any pulsations or lumps or bumps noted, and no tenderness or thrills as well. Okay, so then I went on ahead and palpated the 10 lymph nodes. I named each one: preauricular, postauricular, occipital, jugular-digastric, submental, submandibular, superficial cervical, deep cervical, post-cervical chain, and supraclavicular. They were all intact. And then I went on ahead and listened to his assessed his carotid arteries. His carotid arteries, no problems visibly noted upon palpation. No tenderness or thrills noted. I began to listen. I didn't hear any thrills as well upon auscultation to the left or right side of his carotid arteries. So I did range of motion next. He had full range of motion in his neck. His cranial nerve number 11, which is the spinal accessory, was intact as well with good muscle strength. I moved on to his eyes. I assessed optic nerve, cranial nerve number 2, and it was intact. His external structure, as far as it goes, conjunctiva was nice and pink and moist. Sclera was nice and white. Iris was to his natural eye color, light brown. His cornea was nice and round without any signs of drainage or irritation noted. He was. I also assessed his cardinal fields of gaze. Cranial nerves 3, 4, and 6 were all intact. His pupils equal, round, and reactive to light and accommodation. Let's see. I think that's about it for that part. Yeah, and I moved on to his ears. I palpated his ears. There were no tenderness noted. I assessed cranial nerve number 8, or acoustic nerve. It was intact. Then I moved on to his nose area. His nose was nice and midline. It was no signs of deviation noted. His mucosa was nice and pink and moist. He had patency noted. And I moved on to the lip and mouth area. His lips were nice, pink, and moist. His oral mucosa was nice, pink, and moist, and buccal mucosa was nice, pink, and moist, such as at the heart and soft palate, nice and moist, and pink. Tonsils and uvula was nice, pink and moist as well. Teeth were nice and white without any signs of tooth decay. Gums were nice and pink as well. Cranial nerve 9 was intact. Also, cranial nerve 12 was intact. And patient was compliant in doing so. Of those are part of the assessments. Okay, and then I moved on to the lung fields. Starting with the posterior side of the chest wall, he had full and even rise and fall of his chest, or his chest expansion was full and equal. I also percussed, and there was no tenderness noted, no rebound tenderness, no vibrations noted. I auscultated the lung fields. His lung sounds were nice and clear. Going to the anterior side of his chest wall, his chest wall was nice and clear to lung sounds. No tenderness noted as well. His scapula and spine was also nice and midline. I went on ahead and did heart sounds, and from there, I started by locating the aortic, pulmonic, Erb's point, tricuspid, and mitral valve. And then I began to auscultate using the bell of my stethoscope at the second intercostal space, which is on the left side of the sternum, aortic. Then I went straight across to the pulmonic, which is in the second intercostal space. Then I went down to the third intercostal space and assessed the Erb's point. It was in there. It was intact. Then I went straight down to the fourth intercostal space to the tricuspid valve. It was intact, and to the mid-clavicular line straight down, I went to the mitral valve. It was intact, and also right on side the mitral valve, the apical pulse was intact as well. Okay, there was no jugular vein distension noted as well. No signs of irritation to the pericardium as well. After that, I did the abdominal assessment. His abdomen, his contour was nice and flat. Umbilicus was nice and midline. No visible peristalsis or pulsation noted. I auscultated bowel sounds. His bowel sounds were present in all 4 quadrants upon auscultation. And I began to percuss for rebound tenderness. There were no tenderness noted up to tympany and resonance. I also palpated lightly and deeply without any tenderness noted. Okay, and I moved down to the lower extremities. Before I went there, I also auscultated the vascular sound starting at the aortic, renal. Then I went down to iliac crest and femoral. They were all intact via stethoscope. Then I went down to the lower extremities, did a skin assessment. His skin was nice and warm and dry to touch. Hair distribution was good. No signs of edema or visible varicose veins noted. From there, I assessed palpated the peripheral arteries. The femoral pulse was there, intact. Popliteal pulse was intact. Posterior tibial intact, and dorsalis pedis was also intact. Then I began to complete range of motion. Both legs were nice and symmetrical as well. Starting with the right leg, he was able to complete range of motion. Also with the left leg as well. Range of motion was full in both legs. Moving right along. He also had full range of motion in his ankles and toes as well. Okay, moving right along. Then we went on and the range of motion of the upper extremities. He had full range of motion in upper extremities as well, with good muscle strength in upper and lower extremities. I also did the neural assessment, and I did the patellar reflex. He had a positive patellar reflex, which was good. Also, he had a negative scoliosis.